So, hello, welcome back to Water and Beyond, these 4 days of brainstorming and networking on how water can be developed around the world with the help of the European Union, but also other entities and the private sector. Now we're going to talk about water as an equalizer, realizing impact for human development. This is session one, the key role that water plays. And this is linked to Pillar 5 of the EU partnerships, the international partnership priorities on governance, peace, and security. And the rest, I think we're going to jump now to the Slido itself. Would like to ask the audience some questions here. To get onto Slido, you either go slido.com on your on a web server, and you put WAB 2021, all right? Or you use that QR code. So we see people already weighing in. Which region do you come from? We're seeing that developing. And as we see that developing, I'd like to introduce to you, as I had just been talking to Sara Ahrari, Program Manager for Simavi. Sara, as we're looking at these questions, can you tell us a little bit about Simavi?
Well, Simavi is an international NGO with headquarters in the Netherlands. We work in 10 countries working on water, sanitation, and hygiene, as well as sexual reproductive health and rights. And we work with our local partners to achieve SDG 6 and SDG 5 in addition to other SDGs.
And you are active in which regions?
Africa and Asia.
Africa and Asia, and you can see there, Africa and Asia, there 10% of the viewers are come from those areas. This one of that's a beauty of these sort of hybrid events where we have a global reach, and that shows, that exemplifies that. Can we go to the next question on Slido? Which sector do you represent? This will be interesting too. And as considering all the different speakers we have over these 4 days, they come from many, many different walks of life, different sectors, including government, NGO, private sector, academia, and all of them are extremely important. As we'd said earlier in the opening comments, is that we need to have all hands on deck, all stakeholders, as they call them here in the bubble. Water is overwhelming, but there are other sectors. There's also education present with us, and health, all related to what we're doing. All right, question 3.
Worried.
Can we move to question? Sorry, Sara, do you have something to say?
No, I was getting worried when health was not represented. So I hope, thank God, that there are 4% of the participants from that.
Yeah, that's absolutely, because we're talking about clean water, right? We need to deliver clean water. Which type of entity are you from? So, all right. We get NGOs and government for the most part, but there's also 10% business, as we talk about repeatedly, that private sector investment is way short of what it should be, as Commissioner Lenarčič said, and we need to get more business involvement. And as we talked to the woman from Suez, how they need also to have better regulation that encourages them to get in, to invest more. But that if you do invest, is a 3 times payback on what you do invest. All right. So that's very interesting. Sara, I think I'm going to hand it off to you. You've got one more Slido to talk through, and then you take it away with your panel, right?
Yes, thank you, Chris.
Okay.
There's one more question to answer for you. Is if you think in one word, what is the most vital contribution of WASH to human development, which is the main theme of this session? What comes to your mind? Maybe if there's also the results. Okay, wonderful. I think health is getting more emphasis. And I think if I see that we have 147 participants, but not all of you are on the Slido. So feel free also to use the chat box or question and answer to introduce yourself and talk about where you think that WASH would contribute to.
Sara, there's one thing, I'm so sorry, if I could step in just 1 second, mention, I'm told by the organizers that advising the viewers and speakers to stay connected to Slido. You don't have to break off with that. Keep it open on your screen or whatever platform you're using, so that you can, because we're going to keep asking you things on Slido throughout these 4 days. Sorry, go ahead. Okay, thanks. Yeah, so I think it's what was mentioned here about health and dignity. It's wonderful that was brought up by majority of the participants. So this is also the main aim of this session, to understand better how WASH is actually related to human development. And EU is currently, I understand, is working on actually developing a definition of what human development is. And it's wonderful to have so many of our panelists here who can also shed light onto how this, how contribution to WASH or contribution to realization of SDG 6, which is realizing water and safe water and sanitation for everyone, everywhere, and as well as water resource management, can contribute to human development. And it's, well, I work in WASH sector, so I do believe that it's one of the key principles, but it's also good to have the other view from the panelists to see how it can also contribute towards removing the inequalities, or, for instance, nutrition. Without further ado, I would like to introduce our first keynote speaker. Thank you very much, Mrs. Chris Zacharopoulou. I'm very sorry if I don't pronounce your name very well. Maybe you can introduce yourself. Mrs. Zacharopoulou is a member of European Parliament from the Renew Europe group, elected from France, and is the vice president of the Committee on Development and member of the Committee on Women's Rights and Gender Equality, member of the Environmental, Public Health and Food Security, and a surgeon gynecologist by profession. I was very much impressed to hear about your experiences from my colleagues of how you're championing, bringing this different women rights issues, and as well as, for instance, working on the very underdiagnosed diseases and importance of menstrual health and hygiene, for instance, into the work that you are doing. So I would invite the participant to read more about your experience in the event agenda. But I would like to welcome you, and please. We are hearing about, we are looking forward to hear your experiences about linking WASH with
Merci beaucoup. Je vais parler en français. Attends, je ne sais pas si c'est bien là. OK. Je ne sais pas où il faut que je me mette, mais bon. J'espère que vous me regardez bien. Vous m'entendez? It is okay, the sound?
Yeah, I can hear you.
Okay.
Maybe if you just move a little bit, because I can see you, but you're not also in the middle of the... Okay, that's perfect. Thank you.
OK. Merci beaucoup pour votre invitation sur un sujet qui me tient, comme vous avez dit, au cœur. Lorsque j'ai exercé mon métier de chirurgienne gynécologue, je m'apprêtais, vous savez, toujours à rentrer en salle opératoire, bien sûr avoir ma masque, mais le lavage des mains, la désinfection chirurgicale des mains, c'est très, très important et ça faisait partie de ma préparation. Pour nous, alors, les médecins, si vous voulez, le lavage des mains avec l'eau et le savon, ça fait partie de notre routine. On a vu que depuis 2020, cette routine s'est imposée à tous, des aînés aux plus petits. La crise sanitaire a démontré toute l'importance de l'hygiène des mains, avec les masques, le lavage des mains est la meilleure barrière contre les virus. Le lavage alors régulier des mains avec de l'eau et du savon est devenu un réflexe, une habitude, et est devenu de nouveau la normalité. Nous avons dû réapprendre ces gestes simples, mais qu'ils sauvent des vies, protègent nos proches, en particulier les plus vulnérables. Mais ces gestes, aussi simples, et un luxe pour la plupart des habitants de cette planète. Ce sont presque de 3 milliards de personnes qui n'ont pas accès à l'eau et au savon chez eux. 3 personnes sur 5 à l'échelle mondiale. C'est énorme. Dans nos pays partenaires, le manque d'accès à l'eau et au savon, notamment au sein des centres de santé, constitue un obstacle insurmontable à la réponse au Covid, mais aussi à la lutte contre bien des autres maladies. L'eau et l'hygiène sont la base de la santé publique. Et on le sait, nous ne sommes pas à l'abri de nouveaux virus aussi contagieux et mortels que le coronavirus. L'aspect de futures pandémies nous attend. Tous les yeux, alors, aujourd'hui, sont rivés sur les vaccins. Et la question de sa future disponibilité à l'échelle planétaire se pose de manière tout à fait légitime. Mais le vaccin n'est pas tout. Notre réponse au Covid doit aussi inclure le renforcement de notre résilience face aux futures crises sanitaires. Et cette résilience, elle passera, bien sûr, par l'accès aux services d'eau, d'assainissement et d'hygiène. Au-delà même de la question de la santé, on peut dire que sans eau, il n'y a pas de développement humain possible. Il est donc impératif de réduire les inégalités en matière d'accès à l'eau et à l'hygiène, et en particulier la réduction d'inégalités de genre dans l'accès aux services WASH et ses conséquences, notamment en matière d'hygiène menstruelle, sujet qui me tient à cœur. Une femme sur 3 dans le monde n'a pas accès à des toilettes durant ses règles. Une femme sur 3. Le manque d'infrastructures sanitaires et d'accès à l'eau, notamment dans les établissements scolaires, a pour conséquence que de nombreuses jeunes filles ne vont pas à l'école plusieurs jours par mois. Il est inconcevable qu'en 2021, tant de jeunes filles puissent manquer l'école et compromettre leur avenir juste parce qu'elles ont les règles. Voilà une discrimination de plus dont souffrent les filles et les femmes, et l'Union européenne doit contribuer en s'impliquant dans la gestion de l'hygiène menstruelle en milieu scolaire. Cela passera par l'inclusion d'une dimension de genre dans les politiques d'accès aux services WASH, mais également par la lutte contre les stéréotypes et les tabous autour des règles. Ceci est un exemple parmi tant des autres qui démontre que l'accès à l'eau et à l'hygiène est connecté à bon nombre des autres thématiques et doit s'envisager de manière globale comme condition nécessaire au développement humain. Plus que jamais, l'eau et l'hygiène doivent occuper une place centrale dans la politique européenne de coopération au développement. Je suis très heureuse de la présence de nos experts aujourd'hui, notamment le UNICEF, l'OMS ou encore la délégation de l'Union européenne au Burkina Faso, qui pourront nous faire part de leur expérience de terrain. Je vous remercie et je me réjouis vraiment d'attendre les contributions de nos panélistes. Vous pouvez compter sur mon engagement et oui, comme vous avez dit au début, l'accès à l'eau, c'est une question de santé, c'est une question de droits humains, c'est une question d'égalité et c'est une question de dignité. Merci beaucoup.
Thank you, Mrs. Zacharopoulou. There hasn't been, I was just wondering if you are able to stay with us a couple of more minutes. So if there is
Of course.
Oh, you'll be the host. Okay, that's great. If there are any questions, please type it on the question and answer part. Maybe before, we haven't had any questions so far, but I would like to ask you, because you mentioned also that we can count on your support about supporting WASH in the EU policies and bringing it up. And considering your experiences with working with women's rights and also bringing menstrual health to the position, how do you see what do you think that would be that EU can prioritize both in the different policies that you are working, both women issues and WASH issues, because in many cases they are very much interlinked.
Merci pour votre question. Moi, je vais commencer par un exemple que je puis constater moi-même. Je suis allée au Rwanda l'année dernière, avant le coronavirus. Et j'ai visité, parce que j'ai voulu visiter une école où il avait, comme le programme WASH, il avait une salle où les filles peuvent aller assanger les serviettes hygiéniques, peuvent se laver. Ça veut dire qu'à cette école avait un accès à l'eau. Et je parlais avec les professeurs, les directeurs, et il m'a dit que depuis l'arrivée de l'eau et de cette infrastructure, il a changé toute la question sur l'éducation. Il a vu que les filles, après les 12 ans, continuent, quand ils ont plus ou moins les règles, continuent d'y venir à l'école. Il n'y a pas besoin que les enfants commencent à marcher des kilomètres pour trouver de l'eau et les mener. Et sans changer une question de l'égalité, mais aussi une question d'éducation. Ça, c'est un exemple que moi, j'aimerais beaucoup qu'au niveau de l'Union européenne, on continue à promouvoir et aussi à investir sur ces structures. Comme ça, à chaque école, peuvent continuer à aller à l'école aussi les filles après les menstruations. Je pense, par exemple, c'est un bon exemple de quelque chose que ça marche et que ça peut changer la vie des millions de filles.
Thank you very much, and thank you for being with us today. Considering that our time is very much limited, I would like to go to the next panelist, the next session, the second session of the next two panelists would talk about how WASH can be looked at from the because it's basically it's a intersectoral sector, which links with, as was mentioned, to education, to health, to nutrition, that how they would, we will hear how different organizations and different multilateral and international organizations and government institutes have take this intersectoral approach to WASH and human development. And with that, our first next panelist is Mrs. Kellyanne Naylor, who is the Associate Director of WASH, UNICEF WASH, Global WASH in New York. And since October 2020, she's also the UN Water Vice Chair, and with more than 20 years experience in WASH. She's been trained as civil engineer and work also with the private sector, which we heard also how important it is that they're involved in the sector. With further ado, thank you, Kellyanne. We are all ears.
Thank you so much, Sara, and it's a huge pleasure to be here. Just really wanted to wish everyone a good morning here from New York, or afternoon or evening. I see colleagues connected also from parts of Asia, so really warm wishes for Happy New Year 2021. I just really wanted to convey congratulations and sincere thanks to the EU Commission and the organizers of this event. It's just such a pleasure to be here today and really to be able to share UNICEF's perspectives on how water, sanitation, and hygiene are really an equalizer and a key ingredient for human development. So maybe just to go to the first slide there. I think for UNICEF, and many people know UNICEF, we're the United Nations Children's Fund. I think, of course, the connection is obvious. Maybe next slide. Yes, for children, certainly water is life. It's essential for children to survive from even before their first moments of life, and also, of course, to thrive as they take their journey from a healthy childhood to becoming adults in flourishing communities. And I think very much our work is based on the UN Convention on the Rights of the Child. And of course, this links to the human rights to water and sanitation. Next. I think human development has many definitions, as we've sort of talked about today, but I think in general really relates to people having the freedom and opportunity to have the lives that they value. And certainly, and we've already heard this morning from the keynote speech that water, sanitation, and hygiene contributes to many human development objectives. And I loved this diagram of the SDGs, which of course puts water in the center. I've seen we're not the only SDG to have done that, but I think it does show that we contribute directly to health, nutrition, education, and water, sanitation, and hygiene really being a basic essential service for a decent standard of living, but also shapes better conditions for human development through gender equality, environmental sustainability, particularly in the face of changes in climate that will be felt through water. And of course, an area of growing interest is around water cooperation and how this contributes to greater peace and stability under goal number 16. So I think the week ahead, you'll dive into many of these topics. But just to say, this is coming at a time that is more important than ever. And I think right now with the economic impacts of COVID-19, the World Bank has estimated that an additional 88 million to 115 million people will fall into extreme poverty this year. And this could even rise to 150 million people by the end of 2021. And this is really the first time in the last 2 decades that the poverty rate has risen. And so certainly this can threaten decades of progress on many human development agendas. Next slide, please. I wanted also to say that WASH contributes across the life course or the life cycle. And so while in many ways, of course, the need for water and sanitation is constant across our lives because, of course, we're, it's a requirement for life and our natural processes, but specific needs like the need for WASH in healthcare facilities when babies are born, or the need at adolescents to be able to manage menstruation, it's also something that has specific needs as we move throughout the different stages of life. So time is, of course, really short today, and I know there's a lot of great speakers coming. So I wanted to just focus on a couple specific areas, and one in particular that we've already touched on a little bit around the need for linking WASH and education. Next slide, please. So we've talked about how WASH at School has many benefits, and I think there are many literature reviews that are available, and there is solid evidence that WASH in schools improves students' health, reduces diarrhea, respiratory infections, transmission of intestinal worms. WASH has also been shown to improve attendance, particularly for girls, and some studies even show that when we have robust water sanitation and hygiene packages at schools, this can even increase enrollment. As mentioned by this teacher who's shared this quote for us, certainly when children can spend more time in class and less time hauling water, this also increases safety, reduces harassment, and can create much more comfort and dignity for managing menstruation. Next slide, please. So while it seems perhaps obvious to say that WASH at schools is necessary, unfortunately, this is far from the reality in many schools around the world. And a recent report by WHO and UNICEF looked at the situation of WASH access in schools before the start of the COVID-19 pandemic. And as you can see, we found that 1 in 3 schools either had limited water service or no drinking water at all. Almost 700 million students lacked sanitation. And we've already heard about this critical issue around hand washing. And when we looked at the 60 countries with the highest risk for COVID-19, we found that 3 out of 4 children lacked basic hand washing services at school. So this was not only, an impact during school, but this has also become a barrier for returning to school safely. And UNICEF has estimated that around 1.5 billion children have been affected by school closures due to COVID-19. Next slide. I did want to mention that EU funding has been instrumental for increasing access to WASH in schools in many countries, and just did want to mention very specifically for our UNICEF WASH programs that we have received support from the EU, Zimbabwe, Central African Republic, Papua New Guinea, Yemen, Nigeria are just a few of the countries where we've been really working to close these gaps at school and at home, contributing to positive health and education outcomes. And I just wanted to share quickly this experience from Vietnam, where we could see that access to WASH in schools before the pandemic was also a key to getting kids back to school safely when the time came for them to do that safely. So that puts in a nutshell, I think, the importance also of water and sanitation for resilience during pandemics. Next.
Sorry, Kellyanne, is it possible that you conclude because we are a bit short on
slow on time. Okay, yes, sorry. Yes, I'll go quickly on these next slides. So just quickly, adolescents are, of course, the key group, and also water and sanitation can be a critical way to engage them also as civic participants in terms of encouraging positive practices and social norms in their communities. Next. I think we've already touched on gender equality. I just wanted to point to this excellent study that was done on women and water, the ripple effect, which pointed to 8 dimensions of how water and sanitation can transform gender equality and lead to gender empowerment. Next. In UNICEF's own program, we mainstream the water and sanitation and gender specific result in all of our programs, and we have a specific result on menstrual hygiene management at school and at home and in communities. Next. And last but not least, I did want to mention that simply having availability of water and sanitation services does not mean that everyone can reach them. And certainly making sure that as part of the inclusive agenda of leaving no one behind, that we take into account the special needs, particularly of children with disabilities, which we estimate to be around 10% of children having some form of disability. And just to end on a positive note, I did want to share this experience from Zacharopoulou camp in Jordan, where from the start, the camp was set up with water and sanitation facilities. So next slide to the end, just to say thank you so much for these greater attention and efforts to realize the human rights to water, sanitation, and hygiene. It's not only going to save lives, but also make valuable contributions for this generation of children and future generations to come. Thank you so much, Sara, for inviting us to be here today, to the organizers, and really looking forward to a great session today. Over.
Thank you very much, Kellyanne. I would encourage you to write down again your question and answers, and I assume that Kellyanne will stay with us and then we would try to come back with the answers, but also it's possible to write the answers. To save time, I just don't go to detailed introduction of our speakers, but our next panelist is Dr. Keynote, Secretary General from Cambodia's Council for Agriculture and Rural Development. I'm very sorry to be rude, but I would like to remind you to keep to 5 minutes presentation, and I would be interrupting you, and I'm already sorry if I do that.
Thank you, Sara, and thank all participants. Good evening from Cambodia. I would like to make a short presentation on the WASH and nutrition integration, the Cambodian experience. And my presentation is first about the Cambodian context on nutrition and WASH, and second of the National Strategy for Food Security and Nutrition 2019 to 2023. And the third one is the nutrition sensitive and WASH. And the fourth one is about sub-working group on WASH and nutrition and the achievement. And last is the challenge. So as you may be aware that inadequate access to sanitation has social and economic and health consequences for Cambodian people. Clean water and proper hygiene, toilet and good hygiene practice are essential to the survival of the development of the children. Water and sanitation related disease are amongst the leading cause of sickness and death in children. And 1 in 3 children under 5 were stunting, around 32% is stunting, and 1 in 4 underweight, and 1 in 10 children are wasting. 80% of the population live in rural area, while among half of them lack of access to safe drinking water and sanitation. So to see the importance of the WASH and nutrition, Cambodian have developed the second national strategy for food security and nutrition. As you made that improved nutrition is the cross-cutting issue which require the close cooperation, participation, intervention, investment, and commitment from relevant sector and stakeholders such as agriculture, rural development, WASH, social protection. So, and the second national strategy has been identified the 6 joint priority that focus first on healthy diet, second on nutrition sensitive and vast, and third food value chain, food safety, and food fortification. And next about community-led nutrition and social assistance and food security and nutrition. And last one, we focus on food security, nutrition in disaster risk management and climate change. So our strategy is focused on the twin track approach in order to achieve the SDG that leave no one behind, especially SDG 2, end hunger, improve, achieve food security, improve nutrition, and promote sustainable agriculture. We have prioritized the food security action plan that has 2 sector, the sector-led action and indicator is under the line ministry, that each ministry has to responsible for their own work and responsible to report to the government on their own responsibility on the sector policy. Whereas the joint action indicator that need the coordination that it require the integration that is under the Council for Agriculture and Rural Development where I work for, and at the subnational coordination authority or mechanism that we establish in each province. So in regarding to the nutrition sensitive and vast, is one of the priority in the national strategy for food security and nutrition. And as you know, inadequate access to sanitation impact on social, economic, and health of the people. And wash and sanitation reduce related disease is the leading cause of sickness and death of the children. Therefore, wash is a fundamental determinant of health and nutrition, especially during the COVID-19 pandemic. We also have the approach that we have set up the sub-working group on wash and nutrition, and the strategy, we have 6 sub-working groups. Each working group has to responsibility to implement their role and responsibility. So we set up the sub-working group on wash and nutrition to implement the wash and nutrition sensitive. That is comprised of relevant stakeholders from Ministry of Rural Development, Ministry of Health, Ministry of Planning, Ministry of Education, the provincial authority, donor, UN agency, and civil society and private sector who are work in the wash and nutrition. And the purpose of this group is to bring together wash, food security, and nutrition sector to develop a shared vision and to improve the learning and sharing experience on wash and nutrition integration, and establish the synergy between the sectors to improve quality of programming and service in taking and the nutrition. And we also focus to set up the key priority for this action is to appoint the focal person who can accumulate knowledge about wash and nutrition and develop a cross-sectoral strategy, and also advocate to the Ministry of Economic and Finance to increase the national budget allocation to nutrition and wash, and donor to increase the emerged fund for the opportunity to work on the wash. And our achievement is we have conduct a study on wash and nutrition, the barrier and solution, and result to development of the theory of change for integrated nutrition programming. And the first national workshop on improved hygiene and nutrition make children grow from evidence to impact also organized. And we also organize the National Nutrition Day that we focus on the WASH and nutrition as well. And the Prime Minister also provide the recommendation during the National Nutrition Day that focus on WASH and nutrition, and develop WASH nutrition social behavior change campaign. And in 2018, the government and the development partner brought the outcome of the discussion to the Cambodian village, districts, and province that they have support. And the challenge.
Sorry, Dr. Sok, I'm very sorry to interrupt you, but could you please, because we are running out of time, could you please conclude your presentation?
So this is the last slide.
Okay, great, thanks.
So the national coordination mechanism are not easy replicate at the provincial level, as WASH and nutrition technical working group has no clear structure at the provincial level. And despite the Ministry of Rural Development effort to building a provincial coordination, but CAD has no structure at the provincial level. Therefore, we need to set up the provincial coordination unit that can coordinate the integration nutrition program between provincial departments, civil society, and development partner and private sector. So this is my presentation. So thank you very much for your attention.
Thank you very much, Dr. Sok. Before going to the next session, I would like to ask a question to you and Kellyanne, maybe for a very quick 30-second answer. We haven't received any questions as far as I have seen. But considering that this working outside silos and working with among the with other sectors or with other SDGs has been one of the ambitions of the SDGs, but we all know that it's very difficult to get beyond our silos and that be able to cooperate. And you seem to have championed that, and that has been able to achieve some results of bringing different SDGs together and planning together. Could you say what do you think that it's most important factor for success in that sense, that's intersectoral collaboration, especially when it comes with WASH and another sector? Kellyanne, I
see my I seem to have popped up first on the camera, so I'll go first. Thank you so much, Sara, and I think that's a really important question, because of course the SDGs enable a way for us to work together, but how do we achieve results together? And I think our experience in UNICEF and of course working together with WHO, and I know Maria's up soon, it's really for me about identifying that common outcome. And you know, for UNICEF it may be putting the child at the center and helping to work together with colleagues from education sector, gender experts and others to see how it is that we can really achieve those outcomes together. But I think it does come from a fundamental understanding of how collaboration is going to achieve our goals together. Over.
Thank you very much, Dr. Sok. Would you like to add something?
I think nutrition is the core of the SDG. So if we want to achieve the SDG, we have to invest in nutrition. That as a nutrition as an accelerator for achieving the SDG. So therefore, our government have put the high priority on nutrition in any political platform or political commitment. They put more high priority on nutrition and allocate more fund from year to year, have to allocate more fund for nutrition in order to achieve the human resource development, social development, and human capital development. So this is my thinking.
Thank you very much. And well, have one more question that maybe I rephrase it a bit, because I think one of the things that we also notice is that that what does not encourage collaboration is also this silo investment. So the question is, how do you perceive availability of funds for WASH investment? But I would like to add also how do you see, because then the different investments instrument go, or like they go, but it's very difficult. They don't really encourage that cooperation. So if any thought about this?
So in Cambodia, we have joined the SUN movement, the scaling up nutrition movement. And therefore we have established like a donor network, the UN network, and civil society network on nutrition. And therefore we have meet nearly every month to discuss, to identify the priority area related to the nutrition, and we can mobilize the resource to implement the action plan that we have agreed together. So from those agency, the donor, the UN, and they can assist the government based on the joint monitoring indicator that we identify, and they can mobilize the fund to support the government to implement the action plan on nutrition.
Okay. Thanks a lot. I would like to, because this is to all panelists, I believe the question, I would like to encourage you to answer maybe also in the question and answer type, so that we can move on. I'm very cautious about the time, which we are learning very much behind. So if you allow me, we would like to go to the second session, which is about one of the very dear causes close to my heart. And that's how do we perceive the Leave No One Behind agenda of the SDGs for the SDG 6. And the first panelist, which would be sharing their experience with us, is Tripti Rai, the country director of WaterAid from Nepal, who would be sharing with us their experiences. Thank you very much, Tripti. And please, again, keep in 5 minutes. I would be reminding you, but sorry if I be rude and interrupt you.
Thank you, Sara, and good evening, good afternoon, good morning to everybody. I'm here representing WaterAid, and I would like to share my presentation. If the presentation could be brought on video, please. Yeah, thank you so much. So I've been asked to talk a little bit about the WASH inequalities and other structural inequalities and how they often intersect. And what are we as WaterAid working for water sanitation hygiene for over 40 years across the world? What kind of solutions and what kind of experiences we have? So I'd like to begin with some of the inequalities we see in Nepal, and they often intersect and interact with each other. One of the main ones that you often, of course, hear from Nepal is geography and topography, because we have, we are a small country, but we are made of plains and hills and high mountains. So often in hilly and mountainous regions, the terrains are very difficult. And there you'll see many examples where women have to take long walks in very difficult conditions, often, several times a day to collect and fetch water from water points, and there too waiting for hours to get, to fetch water for their domestic use. In these conditions, what we have been doing is we've been working very closely with the local government and also local organizations to provide technical support, to think of what kind of solutions can help deliver the government's policy, where the government of Nepal has a one house, one tap policy, which is to ensure that everybody has water in their premises. And having done this kind of work in some of the remote places, we do see that it really helps and enables women and girls, especially because much of the water collecting rules are still very, much the women and girls' responsibility. So it provides them with free time to, be more productive in other spaces, or just to have leisure, just to rest. And when you're looking at girls and boys, where our previous speakers already talked about the impact that it has on their education. Another area that we want to, sort of highlight is ethnicity and caste affiliation, especially in the local context in Nepal, where there are groups who are historically excluded and discriminated, which puts them at the, sort of bottom end. And in such communities where you see poverty as well as landlessness very often, we have been trying to work there to see how we can make safe water accessible to such communities. Where it is not possible to have a household tap for every house, we've been working with shared community taps as a possible solution, where there are landless communities who do not have homes, who do not own land, and cannot also pay for private connections. Next slide, please. And of course, this has been very much talked about, but I would still like to re-emphasize that gender, age, and disability pose a very serious barriers to access water, sanitation, hygiene. You'll see there, young girls who are waiting in line to get to the toilet facilities. And you'll also see there that there is, of course, very inaccessible conditions for someone on a wheelchair, for example, to use a toilet facility. Next slide, please. And in such conditions, of course, we have tried to look at gender and age and, child-friendly wash facilities in schools. And we have had great success where wash interventions that address gender issues, both in terms of discrimination and taboos against, for example, menstruation periods that you often find in many contexts in Nepal, along with talking about menstrual health and hygiene, and then ensuring that the women and girls are aware of making informed choices. That really helps to empower them. And that really enables their, ability to pursue their potential. And you'll see their young girls very happy to see wash facilities that are gender friendly. Next slide, please. And just to, sort of wrap up and tell you how we sort of have been working around embedding a human rights-based approach to deliver sustainable water, sanitation, and hygiene. Our keynote speaker and our previous speakers have already emphasized the right to water and sanitation and how that is an enabling right for people to sort of really pursue their potential. So with the right to water and sanitation as a fundamental principle for us, we have worked both at the community end, where we empower communities to be aware of their rights to water and sanitation, to be able to engage with the duty bearers. At the other end, we are also working with the duty bearers, local governments, and other, sort of institutions to be able to understand and prioritize water, sanitation, hygiene in their policies, plans, and budgets. And along with that, to ensure there is an accountability mechanism, we promote the use of social accountability tools such as public hearing, budget tracking, community scorecards, which enable communities to demand for better wash services. And it also creates an interaction and a platform for the government as well as the communities to be able to talk about the various wash issues present in their local communities. So this is basically looking at a system strengthening approach, very much guided by human rights principles. Next slide, please. I wouldn't go too much. This is just a scorecard, which many of you have already seen. Next slide, please. I just have 1 minute. So I want to quickly go. This is just there in our slide to share how we have been able to reach a lot of people in Nepal with safe water, sanitation, and hygiene. You can read the numbers in the slide later, and I will not want to explain this because I would like to use the rest of the time to share with you a very brief video clip from the work that we've done. And then later there are a lot of resources that are linked in for you to share with your colleagues or to look through later. So with that, I'd like to request that we play the small video clip that is there in my presentation.
म कसरी बुझाउँ पहिला पानी नहुँदाखेरि हाम्रो जिन्दगी कस्तो थियो पहिला अब यो शरीरमा यति बालको मैल पडेको अनि वरिपरि त बच्चाहरुका सिगाना लडा मैल पडेको हुन्थ्यो कपडा पनि नौले कपडा पनि फाटा जस्तो हुन्थ्यो पानी नपाएर झाडा पखाला हुने एलर्जी हुने पहिला धेरै मर्थे बच्चाहरु पानी हुन्थ्यो दमिलो त्यस्तै पानीले हामीले धेरै घाटा गर्यो अब अहिले घर घरै धारा आएर हामीलाई धेरै सुविधा भएछ
Thank you so much. I think that's the rest of my time. I would, however, request that there is a link to the full film, which this clip is a part. And if you have time, please do look at it. And if you have any questions, I'm very happy to answer. Thank you for inviting me to the panel, Sara. Over to you.
Thanks a lot for your wonderful presentation. And also, I understand that it's quite late in Nepal. So thank you for also joining us in late hours. I will get back to you with questions. But in order to save time, I would like to introduce our next speaker, Mrs. María Pilar Palmero, head of units Head of Cooperation Unit, EU Delegation to Burkina Faso, to also share your experiences on how to reduce inequalities using the WASH programs. Sorry, you need to unmute yourself if you're still mute. Yeah.
Yes.
Thanks.
Okay. Now, can you hear me? Is still mute?
No, it's good. Thank you.
Still mute?
No, we can hear you.
It's good. It's good.
Yeah, it's good.
Okay. Okay, very good. So good morning, good afternoon, good evening for some of you, like the ones in Nepal. So thanks a lot for this opportunity for the delegation in Burkina Faso. I'm making the presentation, but as you can imagine, this is a teamwork. I'm also accompanied by all the colleagues who are really the experts in the water sector. I cannot see my presentation there. Yes, okay, I can see it now. So in Burkina Faso, just perhaps before going inside into the presentation, well, you know that for the EU, the water and sanitation sector are key areas of our interventions and our approach in development cooperation. But let me make a first point also about the situation in Burkina Faso. As you may know, Burkina Faso is now going through a challenging, difficult situation in the past years. So we have actually, we are in a situation that is not just the development approach. We are in a country with a crisis with more than 1 million internally displaced persons. So the first point I would like to make is that actually as EU and in the delegation, we have really in the past 2 years to respond in the most flexible way also to the crisis. So in my presentation, we have mainly three points, the public policy, and then how we are responding in more concrete terms. Just for us, the SDG 6 is a DG, an important DG, not just in isolation. I think there were interesting points about the intersectoral collaboration and not working in silos and how to improve that. I will come to that at the end. But the first point is basically, as EU, we are supporting the strategy, the water national strategy of the country. This water national strategy has 5 national programs, 5 pillars, let's say: the governance sector, the access to water, sanitation, integrated water management, and all that is aménagement hydraulique. We can move to the next slide. And actually, the first and the main priority is to ensure access and sanitation for all. So our program in the period, the financial period 2014-2020, we approve a water and sanitation sector policy budget support program. It's an important investment in this period for us, together also with health. So main objective: improve access to water and sanitation for the population within an integrated water management framework. I think we can move to the next slide. So this policy support, our support to the national policy has been focused on building the capacity of actors and on a rights-based approach to water and sanitation. We are talking about 54 million euro for this big program, which is has been concentrated on how to better targeting, to reduce geographical inequalities, disparities in the country. There has been also special attention to sanitation, in particular house sanitation in rural areas, and with this focus on access to all, but mainly also vulnerable population. And to this vulnerable population, clearly we need to mention especially the IDPs in these last 2-3 years. The other important pillar is the accountability of public authorities and to ensure sustainability on all these investments. But how this is done? We can move to the next slide. Our approach has been twofold. On the one hand, by budget support, so with the policy dialogue at the center with the government. Actually, in the evaluation of the national development plan that has taken place at the end of last year, water is actually one of the sectors where there has been more impact. And among the reasons, I would say there has been the critical mass between also the World Bank has invested. There are several, key member states, also European Union member states, and us. So at the European Union. So there has been a lot of emphasis on this policy dialogue and huge investments in water and sanitation. The policy dialogue is around key indicators. Indicators, because there is a sector group at the national level. I mean, where all the development partners, the partenaires techniques financiers participate. And then these are in a special, for instance, and this is where it comes, the no silos is also linked to the schools. For instance, there is the access, of water at the schools. Is also the rural areas, is also health. So it is not just the access to water and sanitation in the housing, but also linked to other sectors. So this, I think, is important, and I think for the future we should keep this in mind and this approach. Can we move to the next slide? Because just to clarify, in addition to this policy dialogue, budget support, etc., we have also concrete projects. Grants to partners
to what we call implementing partners for us, and also to the national authorities. We have just signed also a grant in December with the National Water and Sanitation Agency, because we also responding, and that's the flexibility I mentioned at the beginning, to the crisis situation, to the demanding situation in a specific geographical areas, mainly in the Sahel area. And another important
sorry to
point
interrupt,
been,
but could you please conclude maybe
yes?
in 30 seconds or 1 minute?
1 minute?
Yeah.
I'm finishing.
Okay, great. Thanks a lot. Sorry to disturb.
Okay. No, just finishing. Just, I think an important, I arrive into a conclusion. A last, I think, important point linked to also the discussion of other panelists, that for us, for the European Union, will be key in our future programming phase from this year, from 2021 till 2027 in Burkina Faso, is actually what we call the territorial approach. So we will place a huge importance, what we call going local and trying to really develop and support, the local authorities. We are doing it. I'm not saying we are not doing it, but it will be really, really at the center of our approach in Burkina Faso. Because in a crisis situation like the country is living, we really need to respond, to the needs of the population. So we need to find the right mix of instruments on how, to continue the dialogue at the national level, but really also to work at the regional and at the local level. So I would stop here. That's for us is a key message that we would like to pass, because then at territorial level, we will be able also to combine not just the water, but also, with health, with education, a multi-sectoral approach.
Thank
you very much. If you have any questions, I'm ready to answer. Thanks a lot.
Yeah, great. Again, thank you to Pilar and Tripti for their presentations. Maybe just one quick question that any of you would be able to answer in 30 seconds or 1 minute. Is that what I understand when we talk about leaving no one behind, what you mentioned, Pilar, about targeted investments, so really for the disadvantaged group to get WASH facilities. And I think also Tripti also mentioned about addressing the taboos and the barriers that the disadvantaged groups are facing. So, but I also hear from a lot of policy makers and policy implementers and also implementers that it's very difficult to measure the results, that also to disaggregate the results for instance, how you have been able to reach the disadvantaged groups. I was wondering if you can explain your experience on how do you know that you have reached the disadvantaged groups or vulnerable groups with your investment?
Yes, okay. Now I'm not muted any longer. Well, I think we rely for us in the programs implemented by partners. Of course, we need to rely on the information and on the disaggregated data that these partners can provide us. I must say that the Ministry of Water and Sanitation, the Burkina Faso, is a strong ministry. And they provide data quite accurate. They have well-established statistical system with baselines and information quite detailed. So I think this it is there. There is all this work that we can really monitor after that to see that this is happening. Of course, there's always a room for improvement, but I would say happily that I was positively surprised with information coming from the Ministry of Health on the situation, on the number of people, and how this is done. And of course, in this dialogue that we are carrying out, we always, pass these messages.
Thank you.
Over
very
to
much.
you. Thank you.
Thanks a lot. Yeah. Tripti, right? Would you like to?
Yes, very briefly, knowing that your time limit. I think one of the key things is what I'd like to really request and advocate together is we cannot say that it's difficult to reach the unreached or to know who the unreached are, because that is a job that we have to do, our policymakers, decision makers, us as well. So in Nepal, what we are doing is through our work, we are taking, as you said, a very targeted approach. We look at the different layers of inequalities. I started with geographic barriers, then you go into gender and age and disability and all these locations. Now, whatever examples I've tried to bring in are having worked with communities who are unreached or communities who are marginalized and poor. So this is possible, it's not impossible. And we use disaggregated data, like our earlier speaker said. We make sure that monitoring is, bringing up the reporting for our purposes. And we use that evidence generated to advocate with our policymakers and the government. And we have received a lot of also support at the national level to keep working on trying to identify the unreached, to find how we can collect better data. And we are trying to do that and influence at a larger scale. I think a final thing I want to say is, of course, it could be that it's difficult, that it's scattered, that it's hidden, but it is our job to make the people who are unreached visible so that, they are actually not left behind.
Thank you very much. Please also look at the question and answer session and then provide your answers to that session if possible. With further delay, I would like to go to the second session, third session that we have, and it's I think the COVID pandemic has made us all aware, more aware about how WASH is related to public health. But we will hear from our panelists exactly about their experience, how it would be, how WASH relates to the wider health sector. And the first panelist is Ms. María Neira, Director of Public Health, Environmental and Social Determinants of Health of WHO. Very welcome to our session. I don't go to your elaborated experience in the sector and wonderful achievements because of the time, but we look forward to hear your presentation, and please stick to 5 minutes. I'm almost out of the time, so I will be rude, sorry.
Thank you. No, you are perfect. On a chair has to keep with the time. So thank you for the opportunity, and I'm very pleased to really be talking to you on this critical moment. And I don't need to remind any of you that we are on a very, very exceptional situation that will require exceptional decisions and exceptional people and exceptional investments as well. And this is the right time to discuss about this, because at the moment we are talking, many governments, including, of course, the European ones, are destinating funds and new financial support to the COVID-19 recovery. And this is the time when we need to influence those investments. We need to make sure that those investments are going into the right decision to avoid what people call building back. I don't think we should build back. I think we need to build forward, and making sure that this time we do it with all the arguments in our hands. Let me tell you the arguments. WHO did a few months ago, already in May, when we were really in the critical phase of the COVID-19 response, we did what we call it the Manifesto for a Healthy and Green Recovery. And under that, we have identified 6 prescriptions of what we thought it would be the way to have a strategic direction for the recovery. The first prescription, no doubt, it was about recovering our relationship with nature and stop destroying whatever we touch and pollute the water, pollute the air we breathe, pollute the food. But the second one, the second prescription for this healthy and green recovery was exactly about providing essential services. And of course, providing water, sanitation, hygiene were among the basic of the basic, the most cost-effective, the basic public health intervention, the first line defense, not only for COVID-19, but for any infection that will be transmitted by contaminated water or food or our hygiene, lack of hygiene in our hands. It is the best prevention for preventing antimicrobial resistance, for typhoid fever, for any type of diarrhea, for many other things where, of course, the arguments, the science has been working for years and we have all the arguments. So for us, this main prescription, and I will cordially invite all of you to have a look at this manifesto for the healthy and green recovery, where you will see that prescription number 2 is access to basic services. We are trying to tell governments that this is the time to, if they want to recover for COVID-19, and we all know that is very much needed, not only for health, but for recovering our economy. The arguments are there and are very, very strong. And this is a very good economic argument, not only a health one. And this is something that I would like to ask for your help here. I am still hearing in some fora the fact that health is a cost. So we need to look at our budget and see how can we cover that cost. Well, I think now more than ever, please, we need to stop with this absurd statement that health is a cost. Health is an investment. And I think we are all now seeing it very, very clear how good is this investment. If you invest on sanitation, your economic benefits will be 5 times the cost. And if you invest on hygiene, on washing your hands, facilities, your benefits will be 15 times the cost. So I think there is no any ground for discussion on how this is an economic investment is perfectly reasonable, is logic, is common sense. It will help on the recovery after COVID, and it will provide those basic services that until now we have not been able to provide to our societies. The second message I would like to provide is that this session is called Leaving No One Behind. Well, unfortunately, we are already leaving a lot of people behind. We are leaving people without services on water and sanitation. We are leaving people, almost 700 people that are still practicing open defecation. This is lack of dignity. This is lack of basic human rights. This is lack of vision for any country that wants to get out of poverty or wants to engage on development. So we are already leaving people behind, but we have ways to correct all of that. And I hope by this type of engagement and discussion, we will be able to correct it. And if it's not now that we are trying to recover from a pandemic that put us really on a very vulnerable situation, realizing how vulnerable we are as a society, how our health will create this vulnerability, and investing on reducing this vulnerability and creating walls that will protect us better will be a fantastic investment. Those walls have to be on renewable energy, protecting and making sure that we create a green wall on that. But another very, very powerful wall is the one created by WASH. If we invest on water and sanitation and hygiene, we are reducing dramatically our vulnerability to any other type of infectious agent, new outbreak, new epidemic, new, and even other crises that are now clearly threatening us and are already present, like climate change. If we invest on the basics of WASH, I think we can all gain enormously and respond to the society after this crisis by telling them, don't be afraid, but we will make investments on reducing our vulnerability. We will never be able to ensure to our society zero risk, but if we invest on WASH, for sure, we are putting a very strong wall in terms of reducing our risks in front of any other potential outbreak or infectious or agent or any crisis that will be of the many that are threatening us at the moment. With UNICEF, we did a report recently that I'm sure that you will find many responses there, because there is hope as well, and we are providing plenty of arguments of what it will be, the investment that you need to make. For some countries, it might look expensive to invest on WASH, but according to our report, it will cost $1 per capita to enable all 47 less developed countries to establish basic water services and health facilities. So it's something like, it's so logic that when I saw the title of this this conference, Europe, a global water leader, I thought, well, if you want to be a leader, use all the evidence, use all the science, use all the arguments, the economic arguments, and then take the right decisions. And I'm pretty sure that Europe will do it, and we trust that it will be the case. The European region, the WHO European region, the protocol on water and health is a very powerful instrument.
Sorry, Maria, to interrupt you, but
and I'm happy for this investment, and this is the end of my intervention. Thank you very much.
Thank you very much for your wonderful elaboration. I would go to our next panelist because we are running out of time almost. But Dr. Ayon Salaru from Ministry of Health, Labor and Social Protection, Public Health Specialist from Republic of Moldova. Thank you very much for being with us, despite I understand that you were not feeling well. So I really highly appreciate that you could come and join us. With further ado, I would look forward to hear your speech.
Hello to everyone. It's a pleasure for me to attend this meeting. You see, I am for the moment in direct connection from the hospital, but I'm trying to manage all this issue. So for me, water and sanitation is an important issue, and we are convinced now that without good and adequate management, adequate investment in water and sanitation, we cannot achieve a good protection against infections, in our case of COVID-19. And what we consider as one of the most important factors for good environment and good public health. A few words of Republic of Moldova WASH country profile. Around 86 locations of Republic of Moldova already have a water supply system, and 75 of those locations are supplied by small-scale water supply system, which mean some specific requirements for those systems, for maintenance, and also some difficulties with staff, with equipment. Centralized sanitation systems are functioning in almost 800 locations, but only a quarter of them are operating wastewater treatment plants. So in this case, we have some serious problems with wastewater collections and treatment. And water supply and sanitation is considered one of the most priority area for health, environment, sustainable development. Especially in last decade, when quality of life improved, when a lot of people understand that you cannot have a good hygiene without water and sanitation. Next slide, please. So you see access to safely managed water supply system and the sanitation to the left. We have quite a big gap, almost twice, between rural and urban population, but still good indicators for educational institutions. I mean, for school and kindergarten, where almost 94% of school are connected to public supply system. So that means that we achieve a good, first of all, a good conditions for educational institutions. What is related to water? But when we see to access to safely managed sanitation, we see even bigger gap, almost 6 times difference between rural and urban, compared with 2 times difference for water supply. In fact, in Moldova, whole population has access to basic sanitation according to GMP definitions. But with the SDG definition, safely managed services, here we have some problems. Next slide, please. Legal framework, we developed in recent years quite strong legal framework on water and sanitation. First of all, Law 182 on drinking water quality, which transposed EU Directive number 98 from 2008 of EU. Law 303 on public water supply. Also, National Strategy on Water Supply and Sanitation for 2014-2060 years, and which was revised in last year and prolonged to 2030. We have a specific regulations for small-scale water supply, national guidance on development of water safety plans, national regulation on surface water.
Sorry to disturb you, but we are running really out of time. Could you?
Okay, next slide, please. We consider a very crucial role of the protocol on water and health for our country. The Republic of Moldova is a part of European process of the protocol implementation, and protocol is seen as main instrument for offering access to safely managed water supply and sanitation and reduction of water-related diseases since our country became a part in 2005. Moldova set, according to our obligations to the protocol, national targets and target dates for implementation of the national program till 2025, which was adopted by governmental decision in 2016. So this is the first at the European level was a national program for protocol implementation. Next slide, please. And some important national targets for 2025, such as development of specific policies, implementation of guidances, achieving water quality in social institutions. Next slide, please. Actions to improve washing in schools, where provided in national program, and a lot of them were since the last 5 years implemented, such water supply and sanitation projects in more than 300 schools, construction and rehabilitation of wastewater treatment plants from rivers, which increase a lot number of people with access to safe water, regionalization of services for improving drinking water quality, development and implementation of model water safety plans for small operators, also implementation of new projects for water supply and sanitation in school and kindergartens for ensuring 100 access. Strengthening of local associations of water users for improving services in rural areas, because lack of municipal enterprises, so people should combine their efforts and to ensure management in rural communities.
Sorry,
also,
I'm very sorry to interrupt you again. Is it possible that you come to the concluding issues, and then because we are already over time?
Next slide, please. I will pass water and COVID challenges what we face during the pandemic, but taking into account specific of rural areas of schools in Moldova, we provide a huge work with extension of washing and disinfection station in all rural schools. So that's allow us to keep situation under control, and we should consider that till now all schools and kindergartens in Republic of Moldova are functioning at their full capacity with physical presence. And we continue to maintain the situation under control with COVID in school and kindergartens. We initiated the revision of national program under the project UV Plus with kind EU support in 2019, and we finalized in 2020. So for now, what we developed, a situational analysis on program implementation and concept note on right to water and sanitation. We extend period for implementation of the program till 2030 to cover SDG indicators. We revise and extend national targets and action to achieve those targets. We are more focused in WASH, especially WASH in healthcare facilities, because we observe that we neglect in previous version WASH in healthcare facilities. And we have now 2 specific targets on WASH in healthcare facilities, and we plan a general epidemiological survey of WASH in healthcare facilities. So we will evaluate all healthcare facilities related to WASH and to RAM. Draft program was published in November 2020 for public debates, and we will go after that to the government for the approval. Next slide, please. So this is the final one.
Okay, thank you.
I have to conclude that on the national policy dialogue coordination mechanism within the project of UV Plus, we achieved a good collaboration between Ministry of Health and Ministry of Environment. In the last 10 years, national authorities act properly with significant improved situation, but still a lot to do. Many institutions, especially in rural areas, do not offer safe conditions for sanitation and hygiene, which increase the risk of both communicable and non-communicable diseases. It's necessary to implement alternative sanitation solutions in the rural area to simplify access and to offer to people good condition right now, not in next decade. We will start as soon as possible the process of amending of the law on drinking water quality in line with the new EU directive from 2020-2184 on water quality intended for human consumption, which entered into force last week. And we are very happy that this new directive is focused a lot on affordable access, on offering access in particular for vulnerable and marginalized group. And we will use as a model to introduce amendments in our national legislation, a definition what's mean equitable access and how to improve access to vulnerable people, take into account that COVID hit much more poorest part of the population.
Thank you very much and, for your great presentation. And there's also a question for you on the question and answer. And I would like to ask you if it's possible to answer in writing, because we already have passed our time for 7 minutes. And I would like to thank the.
Okay, I can do in writing.
Yeah, great. And I think my colleague would send you the question if you haven't seen it. And I would like to thank the participants and apologize for going further beyond our time. I'd like to thank all the panelists who shared their experiences and wonderful ways of working and lessons learned from how WASH have contributed to human development and reducing the inequalities in different contexts. Maybe just for the very last question, because Dr. Neira was mentioning about also how tackling WASH and would help reduce the health vulnerabilities. Considering that EU delegates and in different countries will be going into the programming process for the next 7 years, I understand. What would be your recommendation for them to have a holistic approach to health and WASH and climate change? Because you are bringing all these different topics in your department. So what would be the one thing that they need to keep in mind?
Well, for all of you who are at the country level and they need to do a budget or making sure that they will allocate some funds, think about the priorities, and water, access to sanitation and hygiene cannot be more priority, more basic and more human right and more related to protecting our health and the most cost effective. With all of those arguments on your hand, what next? I mean, I think it's just a question of being pragmatic and positive and investing where you will have plenty of assurance that you will have enormous benefits, not only for the health of the people, but from a societal point of view and human rights, gender, name it. Thank you.
Thank you very much. And thank you to all the panelists.